Hello, everyone. I know it's been a long time since I posted anything, but I thought I'd try something a little more impromptu and short since I saw this story on Twitter and it got me thinking about a couple things. So let's take a look at this story. This is physically healthy Dutch woman, 28, decides to be euthanized due to crippling depression. A physically healthy 28-year-old Dutch woman has decided to legally end her life due to her struggles with crippling depression, autism, and borderline personality disorder, according to a report. She's scheduled to be euthanized in May, despite being in love with her 40-year-old boyfriend and living with two cats. She once aspired to be a psychiatrist, been dealing with mental health struggles throughout her life. She said she decided to be euthanized after her doctors told her, "There's nothing more we can do for you. It's never going to get any better. I was always very clear that if it doesn't get better, I can't do this anymore," she said. The article goes on to say she is just one of the growing number of people in the West who have decided to die rather than continue living in a pain that, unlike a terminal illness, could be treated. More people are deciding to end their lives while suffering from a slew of other mental health problems, like depression or anxiety, amplified by economic uncertainty, climate change, social media, and other issues, the Free Press. I'm seeing euthanasia as some sort of acceptable option brought to the table by physicians, by psychiatrists, when previously was the ultimate last resort. Steph Groenwood, a healthcare ethicist at Theological University Kampen in the Netherlands, told the outlet, "I see the phenomenon especially in people with psychiatric diseases, and especially young people with psychiatric disorders, where the healthcare professional seems to give up on them more easily than before," she added. When I saw this story pop up, it brought to mind another story that I had seen, I think, last week. This was another case, and this was from March 25th. Calgary judge rules woman with autism can seek medical assistance in dying. And this one, too, this is a woman who is not suffering from cancer, not suffering from a physical disease, but is suffering from autism and ADHD. Interesting passage from the article. "The harm to WV, the person in question, if the injunction is not granted, will be substantial," the judge wrote. "The pain of losing a child, even an adult child, is not something that any parent should experience. The parents have devoted their lives to raising MV from birth and have continued to support her since she has come of age. They will understandably be devastated by her death. For many parents, the loss of a child is a life-changing event that they will never truly recover from. The loss is immeasurable," Feasby said. Feasby said his ruling did not foreclose the daughter changing her mind before the procedure is completed. "What I know of your journey through the healthcare system, from the evidence in this case, suggests that you have struggled to find a doctor who could diagnose your condition and offer appropriate treatment," he said. "I do not know why you seek MAID. Your reasons remain your own, because I have respected your autonomy and your privacy. My decision recognizes your right to choose medically assisted death, but it does not require you to choose death." What strikes me between these two stories, it's this echoed sentiment, and I've seen this sentiment repeated comments under these stories of this idea of autonomy. We have two young women, who really should be able to find appropriate medical treatment for their psychiatric conditions, who are in countries with, as far as I can tell, socialized healthcare, where they should not be economically burdened with seeking this treatment. But because of how complicated their conditions are, because of how tricky it is to handle psychiatric troubles, the system has basically given up on them and given them an out. And to justify it, it's been dressed up in this language of autonomy, a language of respecting your choices. For the last 4 years, especially, we've heard a lot of appeals about mental health and mental health awareness, how we need to talk about mental health and address mental health. Almost every social media site you visit, if there's any mention of death by self-infliction, there's going to be messages popping up saying, here's a hotline you can call, here are people you can look to for assistance. There's such a big emphasis on prevention of this outcome, but since it's become medicalized, suddenly the stigma is gone. Suddenly it's not about intervening, it's not about drawing people away from this possibility at any cost. Now it's, Well, a big shrug and to say it's their choice, it's their body. The sort of atomized reasoning is not surprising. It's what really started medical assistance in dying in the first place. It's what justified euthanasia at the beginning. If we think of the earliest introduction of euthanasia as a practice, we heard that it was for cancer patients. It was for people who were dying of horrible illnesses, who were stuck in horrible pain that could not be cured and was only going to end in an agonizing death. And that's the easy case, right? Almost anyone can look at that and say, even if they don't condone it, they can understand why you would want to be euthanized, why you would want a gentler, more controlled death. But if you really think about it, underneath this idea is also the idea that life should not include suffering, that suffering is the thing that needs to be cured. And that logic has carried into some very peculiar places. So suffering from cancer is one thing, but now we have people coming forward and saying, well, I'm suffering from depression. I'm suffering from anxiety. I have ADHD. I have autism. I'm suffering too. Where's my out? Where is my relief? I think the articles mention that these things are treatable. And I think that's half right, because some of these psychiatric conditions are treatable. But I think it's also possible that some people are going to face mental health issues that will never go away. There are some people who are going to have to live with that their entire life. They might just be anxious forever. Not everyone responds to antidepressants. Not everyone responds to therapy. Some people are just going to be depressed. And I think we've come to a point now in the way we think about ethics and the way we think about life is we don't have a good answer for those people. What do we tell them to do? We can't tell them to suffer. We can't tell them that they have to put up with life because of their loved ones. We have to fall back on this idea of autonomy, that the individual gets to decide what to do with their existence. I remember when euthanasia was first being touted, that conservative Christians really came out in force and really condemned this move. And for a lot of people, they thought, oh, these Christians they're wacky, they're exaggerating, it's all a slippery slope fallacy, none of this stuff is going to happen, because, to be honest, they saw this coming. They understood that once you justified the fast death of a cancer patient, that same reasoning can be squished and molded to justify easing other kinds of suffering. Suffering that's less exact, suffering that is hard to quantify, except by self-identification. I think we're going to see a lot more of these stories, and I think it's going to surprise a lot of people. It's going to shock a lot of people who initially thought euthanasia was going to be a standard quality of life feature of the West. I don't know that it's going to change anytime soon, but for myself, I think we really need to rethink how it is we talk about suffering and how it is we answer people's suffering, whether it's physical or psychological.